I'd like to take a moment with you today to explain the difference between laser vaginal rejuvenation and designer laser vaginoplasty. Laser vaginal rejuvenation for the enhancement of sexual gratification is a tightening procedure which tightens the vagina so that we can feel our partner better during intercourse. As we age and/or as we have vaginal deliveries, women can experience pelvic relaxation. Let me review the anatomy with you for a moment. Here's the vagina. The bladder is right above the vagina. The rectum, or the large intestine, is below the vagina. And then, of course, up here we have the uterus and the cervix. The ligaments, muscles, and fascia in the pelvis can be stretched during vaginal deliveries or as we get older. When this occurs, we can experience bladder prolapse, in which case the bladder can hang into the vagina and sometimes even hang outside of the vagina. Some women also experience rectal prolapse, where the rectum hangs into the vagina and can hang out of the vagina. These conditions can cause stress urinary incontinence and constipation. Laser vaginal rejuvenation procedure tightens the vagina and also replaces the rectum and the bladder into their original anatomic location. The procedure essentially tightens the vagina from the opening of the vagina back to within 2 centimeters of the cervix. In this way, we're able to feel our partner better during intercourse and have better frictional forces. This can enhance our sexual experience. Designer laser vaginoplasty encompasses a series of procedures which addresses the external sculpting of the labia. The labia minora are the labia or the inner lips of the vagina, and the labia majora are on the outside where the pubic hair grows. Some women experience labial hypertrophy, especially the labia minora, where they can have excess tissue that hangs past the labia majora. Sometimes this tissue can interfere with activities such as intercourse or placing tampons. It can also rub against your clothing, jeans, or bulge out in a bathing suit. Designer laser vaginoplasty essentially sculpts up this excess tissue so no excess tissue protrudes past the lamans or the labia majora. There's also the perineuraphy, where a stretched out or scarred perineum is beautified and tightened, and also the labia majora, these external lips, can be tightened as well. If you have any questions concerning laser vaginal rejuvenation or designer laser vaginoplasty, please see my website at www.womenswellnessinstitute.com.